For type 2 diabetes, the focus really is on trying to lose weight and increase activity as the first priorities. Now, not everyone's ready to lose weight or feels it's the right time to embark on that, so you could then say to them, well, yeah, okay, it's not a good time for you to shift on focusing on activity. But if they are ready to lose weight, they need to understand we're not looking for them to lose 50 or 100 pounds. We're talking about 3 to 5 pounds at a time can make a big difference. Again, packaging this as a doable goal and strategy. And so that's what I try to message to people with diabetes. And of course, if they aren't ready to lose weight, even if they're not overweight, 3 to 5 pounds weight loss helps. So you look at their BMI, it could be 24 or 23, but if they're willing to lose 3 to 5 pounds, it will really help their diabetes control. Prediabetes is, this stage of blood sugar control right between normal and type 2 diabetes. So by A1C criteria, it would be having a hemoglobin A1C between 5.7 and 6.4. That is totally possible, and by losing 7% of body weight and exercising 150 minutes a week, we found that people could not only delay the progression to type 2 diabetes, but about 30% of the people reversed to normal blood sugar control. Prediabetes symptoms, there aren't a lot of symptoms. Patients don't have symptoms. So you have to look at their clinical profile for risk factors. Because their blood sugars just aren't that high to create running to the bathroom or excessive thirst. So it's really deciding, do they have a family history of diabetes? Are they overweight? Are they sedentary? And looking at that profile and say, gee, they might be at risk, and let me check their A1C to see if they're in that range. For prediabetes, it's that exercise, 150 minutes, and losing 7% of weight. That was the Diabetes Prevention Program study. It showed that if people do that, they could have a 58% risk reduction of developing diabetes. 58% is a lot. In the Diabetes Prevention Program, we compared the lifestyle intervention to the medication metformin. And the metformin reduced the incidence of diabetes by 31%. And this is the first time I know of where a nutrition and lifestyle intervention was double the impact and more powerful than a medication. I think with type 2 diabetes and prediabetes, the message is the same. There's a continuum there. And focusing on manageable, doable goals around losing weight and increasing activity, and potentially, if they're not ready to lose weight, a Mediterranean type diet, more fiber is the way to go there. And with type 1 diabetes, like I said, for me personally, my effective approach is those 6 diet behaviors. And those 6 diet behaviors, of course, they can be translated for each individual patient in a tailored way, so that one person may learn carbohydrate counting for consistency, another person may have a sample menu, another person may just have some individual goals to shape their eating. And this is where that tailoring with medical nutrition therapy is very important.